Welcome to the second of MHCC and Inform's eYES-CMO information sessions. Thanks so much for joining us today. My name is Corinne Henderson. I'm Principal Policy Advisor at MHCC. And firstly, I'd like to acknowledge the traditional owners and custodians of the land on which we meet today. In my case, the Gadigal people of the Eora Nation, and pay my respects to their elders past and present. I'd also like to acknowledge people with lived experience of mental health conditions, their families and carers, including those here today, and recognise the many contributions to the community and the work of the mental health sector. And just to let you know, we're recording this webinar today. For the last 2 years, MHCC has been working with Inform to pilot the eYES-CMO survey. We have worked with 10 organisations over 92 teams and collected and analysed data over 18 months so far. The online version of the survey, which is offered in addition to the paper version, the eYES-CMO, has now gone live, and this session is about how to use the online eYES-CMO in your service. To tell us all about this today is Sarah Kelshaw, Acting Manager, Clinical Measurement and Benchmarking at Inform. For the last 4 years, she's been working as Project Manager of Experience and Outcome Measurement, System Information and Analytics Branch, New South Wales Ministry of Health. Sarah has been instrumental in making this project happen and taking it through all the hurdles from pilot to full implementation. After Sarah's presentation, if you'd like to ask a question, please raise your hand in the function bar on your screen and we'll unmute you so that you can ask Sarah a question. If you want to type your question, please do so in the Q&A function, and please lower your hand after you've asked a question. So over to you, Sarah. Thank you so much.
Thanks, Corinne, and thanks everyone for joining us. So, as Corinne mentioned, my name is Sarah Kelshaw. I'll be introducing you to the eYES-CMO today. So what we'll cover in this session is a bit about what it is, how you can access it. We'll have an opportunity for a bit of a demonstration, and we'll allow you guys to have a bit of a go yourself. We'll talk about what promotional materials are available, some of the ways you can offer the eYES-CMO, how it links into our existing data and reporting systems, and then, as Corinne mentioned, we'll have an opportunity for any questions that you might like to ask about eYES-CMO or even about eYES-CMO more broadly. So to start with what it is, so some of you may already be familiar with the eYES-CMO questionnaire. So it's a questionnaire that asks people about their experiences of mental health services that are delivered specifically by community managed organisations. So it is part of a suite of national consumer care experience measurement tools. And it was adapted from the Your Experience of Service questionnaire that was originally developed for public mental health services, and it was adapted to make it more relevant and use language that fitted better with community managed organisations. The purpose of the tool is really for service improvement. So it's about identifying areas that services do well as looking for areas that they could improve. So it asks quite detailed and specific questions that are really designed to capture the different types of experience and the different areas of people's experience. And the very short answer to the question of what is eYES-CMO, it's the online version. So the paper version has been available since late 2019, and now we're looking to make the online version available as well. So the paper version will continue to be available. We're not discontinuing that, but it's about making the survey more easily accessible for people and giving people the option of how they prefer to complete it. So when accessing the online version, there's two main groups of people. So the first are people who are already using the eYES-CMO questionnaire. So those of you who already access it on paper and offer it to your service users, in order to be able to use the online version, it's actually fairly simple. So a website has been set up, yourexperience.org.au. You navigate to the website, you enter your service code, As you are an existing eYES-CMO user, your service code will already be built into the system. It's important to note that you need the service code. You need your valid, correct service code to be able to complete it online. If you get to the first page of eYES-CMO and you don't have a code, you're not able to progress into the actual survey questions. To help get that code to service users, we've developed a range of promotional materials and updated some of the existing promotional materials to include that information. And then once a person has gone through and completed the questionnaire, they just need to hit submit at the end, and then that data will be sent through to our secure database. So it's a fairly simple process, fairly simple designed website. The only difference would be for people who are not currently users of eYES-CMO. If you haven't registered to use eYES-CMO yet, you've got a couple of additional steps to do first. So before you can have access and a code to use on the website, you need to register. So once you've registered, we'll then provide you with that code, and then you can follow the same steps as the existing eYES-CMO users. And I'm not going to go into the detail of how you register as part of this session, but we'll include contact details at the end for who to get in contact with in order to register your service, or if you have more questions. So rather than rely on my descriptive skills, we thought it would be a good opportunity for people to have a go themselves and see what it's like to complete a eYES-CMO. So using your phone, your tablet, whatever device you would like, you can either scan this QR code, which will automatically put in our demo code for you, or you can go to this website here and enter the demo code U000. So we have built in this code so that any surveys that come in using this demo code won't affect the real live data. So you having a go now will not impact any of the data that's collected. And I'm going to follow along myself and kind of talk through the website, the design, and some of the thinking while we're having a look. So the website was designed, the original eYES website was designed in consultation with a broad range of consumers and carers to try and make sure that it was fit for purpose, easy to use, and easy to navigate through. So when completing any of the responses to the questions, you can see that it'll highlight the answer that somebody has selected and will automatically move to the next question. All of the questions are exactly the same as what is in the paper form. There is no difference between what is being asked online and what is being asked on paper. It's just being provided in a different way. People are able to skip questions if they choose, just by scrolling past, or you can even go back up and change your response, or even if you decide, you know what, I didn't actually want to answer that question, if you click it again, it'll take away your selection. So people still have the flexibility of choosing which questions they would like to answer and if they'd like to skip or change any. Skip down to the bottom and you can see that we've got this message at the bottom of each page that says, if you don't wish to answer any more questions, please go to the end and click submit. Because this is an anonymous survey, there's no way for us to kind of save information as we go along, or for people to complete some and then come back and complete and finish it off a bit later. So we really need people to go to the end and hit that submit button in order for the data to be sent through. So even if someone got to the end of the first section and said, I don't want to do any more, we need them to just kind of quickly click through to the end and hit the submit button. So that's really important to just let people know that they need to do that. Down the bottom, you can see there's a progress bar that tells you how many of the questions you have answered. So if you're skipping questions like I have been, it'll only count the ones that you have actually answered, but it gives people a bit of an indication how far through the survey they are. And as you can see at the top, there are 4 different sections. So these 4 sections are questions, and then the final section is a bit about action and change and a bit about instant feedback, which I'll show you when we get there. So I'm going to skip ahead to question 28, and the reason I've picked question 28 is not completely random. So question 28 is the overall, how would you rate your experience of care question? And that's what we've used when we get to the instant feedback section at the end. So it's also important, if someone's not keen on answering every single question, if they'd like to see some kind of instant feedback, they're going to need to answer question 28. So just a bit of a summary question. So I'm going to give it an excellent. We've also still got the free text questions that are available on paper. The upside about doing it online is that people can actually fit more information. So I think it's just over 5,000 characters people are able to enter into each of these text boxes, which is a lot more than you'd be able to fit on the paper forms. People can't paste pictures, they can't paste those sorts of things. It's just the text that they're able to put into these boxes. We include the demographic questions that are on the back page of the eYES-CMO that just allow us to kind of understand if different groups of people are having a different experience. So all of these are covered in the online version as well. And it will also be that those answers to those questions will also give us a better idea about who might be choosing to complete online versus on paper and those sorts of things. Once the survey is complete and a person has hit submit and their data has been sent off, they're presented with this screen. And this screen came out of the consultations that we did with consumers and carers. And it was around people wanting the option, whether or not they got to see that instant feedback. They wanted it to be their choice. So we created this screen that appears in the middle that tells people a bit about what's going to happen with their data, a bit about the action and change cycle, and then gives them this option as to whether or not they want to view their results compared to other people. If they don't, they can hit the finish button. If they do and they click view results, this is what they'll see. So they'll see what their rating on that question 28, which is a score out of 5, and how that compares to the average rating that people have given other CMOs in New South Wales. So we've kept it at that kind of high level comparison across all CMOs and anybody who's provided feedback. There's a little bit of information about how the scores are calculated, and then we link out to the pilot project report that's been completed following the pilot that we did as well. As you can see, when you hit finish, it brings you back to this first screen again. So there is nothing theoretically to complete it more than once. I will say this is not something we see, this is not kind of an issue we come across very often, that people will kind of go in and complete it again and again and again. But yes, once again, in order for it to remain completely anonymous and for us to not collect any information about the people who are completing it, there's nothing we can really do in that space. So that was the super quick demonstration. You are more than welcome to log on in your own time using this demo code. Make sure if you're doing it, you're using this demo code, not your service code, because otherwise we will be reading that as real live data from your service users. And yeah, you're welcome to have a look, have a play, get familiar with how it works, because it can make it easier when offering it to kind of have some expectations and explain this is what it's going to be like filling out the survey. I mentioned earlier that we've developed some promotional materials, and really they're designed to try and help get that service code to your service users. So we've developed QR codes, unique QR codes for each of the teams. And you'll be provided with a sheet of labels for those that you can print off and apply to other resources. And then there's some really simple, A4 sheets like this that you can print off yourself and provide to people as needed. And it just gives pretty much the two options for how you can get to the website, either manually or using a QR code. For these labels, we have updated the existing eYES-CMO brochure to include this little section on the back. that tells people how they can access eYES-CMO online. And there is a specific spot that you're able to put that sticker. The reason we've done that is rather than having, 100, 200 different versions of the brochure and you needing to make sure that you've ordered the correct one, or in order to be able to share resources across different teams, we've kept the actual brochure generic. It's just the labels, the stickers that are unique to your services. There's also, so this brochure, there you go, I've got a little example of where you would put the sticker. And this brochure is available to order now from the online ordering platform. So the place that you currently order, for those of you who are already using eYES-CMO, the place that you currently order your paper forms and your brochures from, this version is now available there. There's also nothing theoretically from stopping you to applying this sticker to any existing brochures you may have. The only thing it won't include is the manual steps for how to get to the website. So you'd be relying on people using the QR code, and you'd need to explain it a little bit more when you're offering it, so that they understood how to do that. Other materials that we've developed to video that's been updated. So this was first developed when the eYES-CMO pilot started. So it's now updated to include information about the online version as well. And we can provide unique links to the website with your service code embedded in it. So really that's the link that kind of sits behind the QR code. And those are helpful if you are wanting to, SMS or email links out to your service users. We've also updated some resources for staff. So the service guide's been updated to provide more information about the online version, the resources available, that sort of thing. And then an explainer video has been developed, similar to the one for the service users, but just aimed at explaining the process to staff and how it all works. So these resources will be made available to you. So following these sessions, we're going to be packaging up these resources and they're going to be distributed out to any of the CMOs who are already participating in eYES-CMO. You will be sent this information, and for any new teams who aren't currently participating, when you register, you will be provided with this information. So it's going to become part of the standard process when a team is registered, that this information will be provided. So when it comes to offering the eYES-CMO, you can work it into, if you've got existing processes for offering the paper forms, you can work it into those. And then it kind of depends on your services, the resources you have available, and how you operate as to some of the ways you can offer it. But some of the examples are really, you can invite people to use their own devices. So you can provide them with promotional materials that they can take away and use. You can make those QR code resources available in your waiting areas, your shared spaces, or you can send links using messages or emails if you're set up to do that. Or some services may have devices that they're able to offer people to complete the survey on. So they might have tablets or computers or other resources where you can save the website and your service code as on the homepage or as a favorite to make it kind of easy to access. So they're kind of the main ways that you can do it. In terms of actually what you say when you're offering the eYES-CMO, it shouldn't really be too different to what you would say when you're offering the paper form. It's just about letting people know that they have options in how to complete it, and that using the online version, it's still completely anonymous. There's no way for us to identify who is completing the survey. Yes, it's just a different way that they're able to complete that feedback. In terms of how this new online version links in with our existing data and reporting, So the data collection process itself is actually simplified when using the online version. So when a person completes the eYES-CMO on paper, there's a process in which it's posted, collected from a PO box, scanned, the data is sent into to us and imported into our database, and then goes through our reporting systems. With the eYES-CMO, as soon as they hit submit, it goes directly into our secure database. So all those middle steps are kind of taken out. And often we find that if there are any issues where people, are saying, but we feel like we've submitted more questionnaires than we're seeing in our reporting, it's usually in those middle steps that we'll find that there's delays or issues. So in the postage or the scanning. So in many ways, the online version makes the whole process a lot simpler and easier to identify if there are any issues, because they're more in our control. So those of you who already collect eYES-CMO, this report will look familiar. So this is our usual quarterly report that's provided to services, and any of the data that's collected in the online version is going to be reported alongside the paper forms. So there's no kind of separate reporting system. They'll all be grouped together in your quarterly reporting. So in your average responses to any of the questions, you'll have a mixture of your paper and your online, depending on which method you're using to offer. We can look at adding in potentially something that tells us, what proportion are coming in online, and that's something we could look at from time to time in the raw data as well, if people felt that. So overall, from the data and reporting side of things, the web version makes things easier. Nothing's really going to change from the reporting side of things. The only thing that we hope to see is more returns, because we're more easily able to access people and they're more easily able to give their feedback. So we've held a good portion of time to kind of focus on any questions you might have. As I mentioned at the beginning, we're happy for any questions about the online version, happy for any questions about the eYES-CMO more broadly. And yes, it's kind of over to you all for any thoughts, questions, anything you want to raise.
Thank you, Sarah, very much. That was really, really useful information. So if anybody's got any questions, if you want to put up your hand or put something in the Q&A while you're thinking about that, maybe. Sarah's already covered the question that I was going to ask, which is you will get from time to time the proportion, because that's always quite interesting to know how many people, how much they favor the EES as opposed to the paper, and the data you'll receive is 3 monthly. But just in case people are interested to understand why we have codes rather than the name of your service, is because it's quite critical that this data is de-identified. We never wanted this survey to be a way of benchmarking you against other services. So we really wanted to keep it anonymous so that when you get the data, you can look at it and measure one team against another in your own organization, but there is nothing that Inform can do to say, well, Wellways does this and NEMI does that, and that's the reason we've really tried to protect the anonymity of your teams. So it's really a quality improvement activity, not a benchmarking activity. So if anybody's got any questions, I can't see anything coming up. Thank you all very much for attending. If you do have any questions for either Sarah or myself, you're free to email us at any time, and there's my email and there's Sarah's email, so feel free if you think about something. And if you think about something, when you start doing it, it doesn't matter when it is, we're here and happy to answer all your questions. So thank you very much. If one last go. Has anybody got a last question? If not, you get an early mark and we can all go early. You can all go back to your work. Okay.
And I might just add, Corinne, that, you know, when you're thinking about how to implement this in your services, it's designed to be flexible. It's designed to work in, you know, there's not really kind of strict, you must offer it this often, you must do it this way. It's designed to be flexible, to fit in with what works for your services, because all services are a little bit different.
Yeah.
So yeah.
Yeah, well, thank you for that, Sarah, because that was a question that did come up last time, like when do we do it and how often? That's entirely up to you, as Sarah says, you know, depending on what kind of service you're offering and what you think is appropriate, how long you work with your clients, you know, when they come in, when they exit, or whether they're long term. So we've recorded this, and in about a week or so we will be uploading that to the website, and we'll also be sending you an evaluation. We'd really like to know whether this has been useful, whether we need to do some more down the track. And to thank you all for your participation today. We really appreciate your time. We know everybody's busy, and so we thank you for participating. And we look forward to working with you down the track. Thank you very much, everybody. Thanks. Bye-bye.
Thanks. Bye.